there are many types of birth control that can help prevent pregnancy. You're likely familiar with birth control pills, which are taken daily to prevent ovulation. Levonorgestrel, more commonly known as Plan B or the morning after pill, is different. You take it after unprotected sex as emergency contraception. Here's what you need to know when taking Levonorgestrel. Several things must happen for a pregnancy to occur. First, your ovaries must release an egg, which is a process called ovulation. Then, sperm must make it to the uterus and fertilize that egg. Having unprotected sex around the time of ovulation increases the chances of becoming pregnant. Next, the fertilized egg must implant on the wall of the uterus. But pregnancy doesn't always happen in this order. Sperm can survive inside the uterus for several days. If you have unprotected sex and then ovulate a few days afterward, there is a chance you could become pregnant. This is where Levonorgestrel comes in. It works by delaying your ovaries from releasing an egg. Without ovulation, the sperm won't have an egg to fertilize, thereby reducing the risk of pregnancy. Plan B is an oral pill that you take within 72 hours of having unprotected sex. But the sooner you take it, the more effective it will be. That's because it can't stop a pregnancy once an egg has been fertilized. On average, it's about 87% effective at preventing pregnancy. There are many brands of Levonorgestrel. Your medication may look different depending on many factors. You should know that Levonorgestrel is available over the counter, meaning you don't need a prescription from your doctor. There are no age restrictions, and you don't need to show ID. You may need to ask a pharmacist to access it, since they are sometimes stored behind the counter. It's not recommended to use emergency contraception as your regular birth control. Other types of birth control, such as the pill, are generally much more effective and affordable. Talk to your primary care provider or OBGYN if you're looking for the best birth control option for your needs, budget, and lifestyle. Another reason not to use the morning after pill as your go-to form of birth control is that it tends to cause more unpleasant side effects than regular birth control. These often pass quickly, but side effects include a heavier period than usual, nausea, stomach pain, tiredness, and headache. Taking Levonorgestrel with food may help reduce nausea. Some people believe bleeding after taking Levonorgestrel means it worked. This isn't necessarily true. Spotting could also be the result of implantation bleeding, which is when a fertilized egg has actually implanted on the uterus, which would mean you may be pregnant. The best way to know if emergency contraception has worked is by getting a negative pregnancy test. You might have a lot of emotions, fears, and questions when taking Levonorgestrel. Even though it's available over the counter, feel free to talk to your pharmacist or your primary care provider to get all your questions answered. They can also refer you to other resources that can help you with next steps, depending on your needs and circumstances. Don't be afraid to ask your pharmacist or provider about affordability. These days, there are many options for cheaper ways to get your medication.